Well, since the spring, UT Health RGV Clinical Lab has been focused on testing for the coronavirus, and now they're expanding their services.
Local 23's Jeremiah Wilcox spoke to researchers about the addressing needs across the valley and their hopes to decrease wait times.
Running about 10 to 12,000 samples a month.
It's been a busy few months for Dr. John Thomas inside the UT RGV lab. He's the lab director, and since April, he says they've tested 90,000 samples from across the valley and state, testing for one virus.
Selected to participate in the state of Texas's task force on COVID over the summer. And that task force was responsible for testing samples that were gathered all across the state.
Now there's a change with the addition of COVID-19 testing. They're adding more testing for illnesses to their lab.
The testing's not really done here. It's usually put on a truck and sent to San Antonio, or maybe it's put on an airplane and flown to Dallas or to Austin. And so those samples, they leave the valley. They now have to wait to be received at their new site. They have to get tested, and then the information's got to be sent back.
And that process can take a day or more. He tells me sending samples outside the RGV can be a matter of life and death.
My mother-in-law had stage 4 lung cancer, never smoked a day in her life. She just came down with lung cancer. And what ultimately ended up killing her was the fact that the drugs she was taking caused her cancer to mutate. And unfortunately, this mutation happened when she was away from her doctor for a 2-week time. And by the time she got back to the doctor, it was too late and she died 2 weeks later.
Testing for the new virus won't stop.
Half the people we see don't have insurance. We want to make sure that they're able to get the same high quality testing at a cost that's going to be, easy for them to bear.
Getting faster answers for faster treatment. Putting local first in Harlingen, I'm Jeremiah Wilcox.
Dr. Thomas says they're going to centralize all the testing being conducted at the 25+ UT Health RGV clinics throughout the valley through their main lab in Edinburgh.